Good evening. I'm Saraya Mia and you're watching AWANI Tonight. The appointments of chairman and board members for the federal statutory bodies and government-linked companies GLCs may take up to 2 months. Deputy Finance Minister Datuk Sri Ahmad Maslan said these appointments should be done carefully and not in haste.
Ahmad said they are still waiting for the next cabinet directive on when the vacant positions of chairman and board members to GLCs and other government bodies will be filled and by whom. On December 14, the government issued termination letters to all existing political appointees to these institutions. Last week, Deputy Prime Minister Datuk Sri Ahmad Zahid Hamidi said the appointments were being streamlined and would be announced by the Prime Minister Datuk Sri Anwar Ibrahim.
Former Rembau MP Khairi Jamaluddin has moved his UMNO membership from Rembau to Sungai Buloh, where he contested in the 15th general election. He says he is determined to stay there until he wins Sungai Buloh.
In a TikTok video posted to the BN Sungai Buloh account, the former health minister announced that his name in the UMNO membership system has now been placed under the location. He explained it isn't fair that upon losing in G15, he would disappear and contest at another place. Khairi said although the matter of choosing the election candidate for the next general election is still up for discussion with the UMNO Sungai Buloh division, he is determined to make the seat a BN stronghold. In GE15, Khairi lost the Sungai Buloh parliamentary seat to Pakatan Harapan's Dato' R. Ramanan by a slim margin of 2,693 votes. It was his first time contesting there after serving 3 terms in the Rembau parliamentary seat.
Meanwhile, the current health ministry is drawing up plans to tackle overcrowding in emergency and trauma departments in hospitals. Minister Dr. Zaliha Mustafa said this is to provide quick and efficient services to the people.
She said her ministry is identifying problems facing emergency and trauma departments nationwide by studying latest data, conducting audits and research on workload and overcrowding, especially in specialist hospitals. Dr. Zaliha added that the Health Ministry will engage with relevant stakeholders, including the emergency department itself, the Malaysian Medical Association, the Association of Private Hospitals Malaysia and the private sector. The 2018 Auditor General's report published on June 24, 2019 identified that the causes contributing to the congestion were insufficient allocations, a shortage of health personnel and lack of facilities to meet patients' needs.
Now we speak to Association of Private Hospitals Malaysia President Dato' Dr. Kuljit Singh for his take on the extent of overcrowding issues at emergency departments. He also gave suggestions on how to tackle the issue.
One of the reasons why there is congestion in all emergency departments, both in private and public hospitals, is because there are lack of staff, both in the emergency level, where there are not enough of medical officers or even nurses. So it takes time for patients to be seen by medical officers and the nurses in order to clear them. The second issue happens is after clearing patients, then there are not enough beds in the wards if you need to admit them. And the reason why you don't have beds in the ward is usually sometimes because in order to open up beds, you need to have enough nursing staff. Currently, we are having a shortage of nurses throughout the country, including private hospitals. We are not able to open up more beds because we don't have enough nurses. So that becomes an issue. The patients have to wait for hours together, and sometimes in certain hospitals, maybe days before they get a bed in a hospital, both in public and private. But definitely in private hospital, this is quite a big issue for the last 6 months.
He said Malaysia focuses a lot on investments in facilities, but lacks investments in human capital, which mostly leads to brain drain in the healthcare sector.
Many of them will migrate to other countries even for a little bit more because they really have no choice when the remuneration is really poor. We should restructure our healthcare system, make it out of the public service, especially for the public sector, so that their fees are not payment and the salaries that are paid to the healthcare workers are not tied down to the public service scales. I think that's the only way if they are serious about solving this problem quickly. For the private hospitals, we have asked this a few times to the government stakeholders to allow us to hire nurses from overseas because this would be a short gap method so that we'll be able to get a workforce in order to open up more wards in the private hospitals. Currently, we have patients waiting in private ER, private emergencies with money, patients who can afford private healthcare, but they are not able to get beds because there are lack of nurses in the private hospitals. We do not want to further strain the government hospitals by sending these patients to government hospitals when we are not able to serve them in private hospitals. I really urge that the government of the day will reconsider and allow us to get nurses from overseas, even those who are not subspecialized.
The landslide in Batang Kali on December 16 is Malaysia's second worst disaster in terms of casualties. According to the Special Malaysia Disaster Assistance and Rescue Team SMART, this comes after the tragic Highland Towers condominium collapse in 1992, which claimed 48 lives.
A total of 91 people were affected in the 2:30 a.m. landslide at the Father's Organic Farm campsite. 31 lives were lost while 61 survived after tons of earth came crashing down on the farm campsite. 18 of those who perished were adults and 13 children. SMART Commander Muhammad Khairul Jamil said he was shocked by the number of victims, where in previous landslides only 3 or 4 people were involved.
We'll go for a quick break. Stay with us.
Telah banyak yang saya lalui. Pasang surut kehidupan membentuk diri saya pada hari ini. Dengan kerja keras, keyakinan dan sokongan padu keluarga, saya mampu sampai ke puncak. Akan tetapi, kepedihan dan kekalahan bukannya halangan. Saya mengatasi setiap halangan dan kembali kuat.
Gardenia Breakthrough, mengatasi setiap halangan.
Abah kamu ada je yang tak kena. Hari tu,
Wish, laju. Mari. Sebab tu, plan dia sekarang ni paling laju. Ada macam-macam. Hebat RM10 pun dapat. Opah tu, opah ni, awak pun nak juga kan?
Nampak gaya dua-dua ni nak Digi Fiber. Adik pun berhajat nak talent family kan?
Ceritanya semua orang nak.
Ini pelanin terbaik untuk keluarga.
Sama-sama kita melangkah, bergembira seisi keluarga. Malaysia penuh panorama indah, berbilang budaya Malaysia. Cuti-cuti Malaysia.
Welcome back. On top of resuming the move to review laws related to the mandatory death penalty, Law and Institutional Reform Minister Datuk Sri Azalina Osman Said says the government will also look into reforming the criminal justice system. Human rights lawyer Samantha Chong stresses this must include amendments to Malaysia's drug policy and prison systems.
Well, if you look at the prison system, it is currently being flooded with about 70% of non-violent minor drug offender. By that, I mean those who use drugs or those possessing small amount of drugs for possessions. So in order to look for prison reform, we need to look at our drug policy and drug laws. Why our prisons is full of them, is overcrowded, and is our drug policy and law really working? So I would say without reforming the drug policy, we will not be able to solve prison overcrowding issues. And why prison overcrowding issues is important is because if we can't reform these people, we don't figure out what is the most effective way of helping them, they will always go back to the systems.
Samantha adds that the shift towards restorative justice must be approached in a holistic manner.
I think How the restorative justice will be structured very much depends on, Malaysian context, not just, copy and paste from Western country. I think we need to look more into this. Former law ministers, I think the late VK Liu, Wan Junaidi, and also the current law ministers has suggested to establish a law commissions to really look at, what sort of laws that we need to review. I think this will be a great start. We to look at our criminal justice systems, especially in the light of retroactive justice, because our criminal justice systems cannot just be a mechanism to claim for blood, but it has to be a mechanism that make our society a safer place. There are multiple stakeholders. Among others are the police, the KDN, the prisons, departments, bar councils, and NGO workings on prison reforms. Perhaps there should be a public hearing to listen as well to the public, not just because now it is not the era of government know best. The voice of the society need to be heard. So I think we should take a very holistic approach towards it, and not just, based on what is right according to perception.
On to international news. Heavy snow in parts of Japan has killed 17 people and injured over 90. Many parts of northeastern Japan reported 3 times their average snowfall for the season.
Powerful winter fronts have dumped heavy snow in northern regions since last week, stranding hundreds of vehicles on highways, delaying delivery services, and causing 11 deaths by Saturday. Many of them fell while removing snow from roofs or were buried underneath thick piles of snow sliding off rooftops. Authorities have urged residents to be careful during snow removal activity and not to work alone. Meanwhile, heavy snow knocked down an electric power transmission tower in Japan's northernmost main island, causing 20,000 homes to be left without power on Christmas morning. Dozens of trains and flights were also briefly suspended in northern Japan through Sunday.
Meanwhile, 4 international aid agencies have suspended their humanitarian programs in Afghanistan. This was in response to the Taliban's order to ban women from working.
On Saturday, the Taliban administration ordered all local and foreign NGOs not to allow female staffs to work until further notice. The Taliban justified the ban by claiming some women did not adhere to their interpretation of Islamic dress code for women. NGOs Save the Children, Norwegian Refugee Council, Care International and International Rescue Committee IRC said they were suspending their work as they awaited clarity on the order. The organization said they could not effectively reach children, women and men in desperate need in Afghanistan without female staff. The IRC employs over 8,000 people in Afghanistan, where about 3,000 are women. A Taliban spokesman has hit back at growing criticism towards the ban, saying all institutions wanting to operate in the country must comply with its rules.
3 more bodies have been recovered from the waters after a Thai warship went down in the Gulf of Thailand a week ago. The death toll is now up to 18, and 11 members of the crew are still missing.
The Navy said the 3 bodies will be brought into identification and autopsy, which will take about 3 or 4 days. The HTMS Sukhothai sank on December 18 in the southeastern coast, with a massive rescue operation managing to rescue 76 crew. On Saturday, 1 body was found and confirmed as a crew member, and a further 2 were discovered without details. Helicopters, unmanned surveillance aircraft, and warships have been combing the sea in hope of finding survivors. The vessel, a corvette among the smallest of military warships, ran into trouble after its electronic system was damaged.
A boat with over 57 Rohingya refugees reached the coast of Indonesia's western Aceh province. This comes after United Nations High Commissioner for Refugees announced the possible sinking of a boat with 180 Rohingya Muslims on board, all presumed dead. The agency said 2022 could be one of the deadliest years at sea in almost a decade for the community.
The 57 refugees had spent nearly a month drifting at sea after their ship's engine broke before reaching the shores of Aceh. The number of Rohingya leaving Bangladesh in boats this year has jumped more than 5-fold from a year earlier. 2 boats carrying a total of 230 Rohingya refugees, including women and children, landed on the shores of Indonesia's Aceh in November, while this month, Sri Lanka's Navy rescued 104 Rohingya. Nearly 1 million Rohingya from Myanmar are living in crowded facilities in Bangladesh, including tens of thousands who fled their home country after its military conducted a deadly crackdown in 2017.
Now that ends the show tonight. Thank you so much for watching. I'm Saraya Mia, and we'll see you again.